Measles is one of the most contagious viral infections in the world, and so far we have over 10.3 million cases recorded all over the world and over 1,000 cases recorded as the death cases. These cases are mostly recorded in low and medium countries, and children under 5 years are mostly affected, despite the fact that measles is a vaccine-preventable disease, and this poses a challenge in the health system of people in Nigeria and in South Africa. Little interference in vaccine programs or vaccination programs will likely disrupt the healthcare services and will lead to a massive outbreak of the measles.
So we want the caregiver to tell us her name, the name of our child, likewise the age of the child.
Za ki faɗa mana sunanki da sunan yarinyanki da shekarunta. Sunana Ibrahim. Da kuma sunan da Fatima.
The child was conceived in the night. Then from the morning that they wake up, that she realized that the child has Measles rashes.
In 2024, the Nigerian Center for Disease Control and Prevention recorded over 20,000 suspected cases, and confirmed cases were about 9,000 in number. And we have over 77 measles-related deaths in Nigeria. And in South Africa in 2024, the National Institute of Communicable Disease recorded over 900 confirmed cases, and 40% of these cases were detected in real time in South Africa. The need is that the resurgence of measles is threatened, and if we're able to improve surveillance and immunization activities, it will help in reducing the cases of measles in Nigeria and in South Africa.
My name is Yolandi Luther. I'm the EPI and CDC manager for the West Rand Gauteng province. So Gauteng has about 443 cases since the beginning of the year, with the majority of cases in Tshwane and in city of Joburg at the moment. So those are our hotspots areas. So because the outbreak is so large and in such a huge scale, we have decided to do a Gauteng-wide campaign. So the whole Gauteng is doing a mass measles and rubella vaccination drive in order to reach as many children as possible between the ages of 6 months and 15 years. So unfortunately, vaccine hesitancy is a huge phenomenon, not just in our country, but everywhere in the world. And unfortunately, what is happening is that we are focusing it more in the schools and in the creches, and our parents are not signing the consent forms. So when we see that the consent forms do not come back, or there's a high decline rate, we do some interviews to find out. But most of the time, parents are concerned. They've already received the measles vaccine. Do they need another one? And they do. Another additional dose. A child can have as many measles and rubella vaccines as they want in their lifetime. It's good. It's safe. There's no dangers around it. And also with this one that we are giving this year, it's measles and rubella, and it's that added confidence and added immunity that we wouldn't have in the past.
Rashes with conjunctivitis. Then she starts thinking of what to do. Then one of the health personnel came to her house. Then she asked them to look whether this is measles, because she's suspecting measles case. Then the health worker told her that this is a real measles case. She should take her to the facility. And when she said that what she see in the child body, like the popular rash, the conjunctivitis, and even in her mouth, she noticed that there is later for certain measles case. She just think that she wants to take the child to the chemist, nearby chemist. Then when that health worker insists that she should come to the hospital bed, there is a measles drug there. Her body has temperature with catarrh. That's running off. That she was thinking that she have no money, and now she has measles. Maybe they are going to take the money they're supposed to use and buy drugs.
Has popular rashes, which is the major symptoms for measles disease in a child. Down Qatar's community, we are about to head on to the household where we have the measles case. This is the household of the measles case, which was interviewed. So I just want to ask her, how is the vaccination status and how the community react to immunization?
sosai ba, amma dalilin yanzu da kuke aka zo da maganar maganin da yanzu da suke karfafa zuwa su ji sasa rigakafi. Saboda kwanakin bayan suna sun yi da aka bi iska amma ba a da kula aka mashi.
Okay, what she said that they do come for immunization, but not all. But because of the campaign and the awareness, now I think there is improvement.
That's good. So what is our advice to other parents?
yawo shi ba ya bar su ce asibiti domin a duba a kuɗi gaci don a gane shi a yi maganin shi kafin ya fi wani matsayi.
You will advise the neighborhood that wherever they see the signs and symptoms of measles, they should rush to the health facility.
So thank you for your time. We really appreciate it. And wish you a journey.
Ya ce ya gode miki ya kuma yana fatan Allah ya ƙara bata lafiya nan da nan ta warke cikin kankan
I'm calling us Sylvia Ezenwa-Ahanene. Oh, I see.
What's been your experience managing children with measles cases?
You treat them. The drugs we give.
You say you have been managing them accordingly?
Yes.
Okay.
Where you supposed to.
What are the symptoms that you usually present?
Rashes all over the body, eye redness, eye discharge, fever, cough, sometimes a complete headache or catarrh.
So what challenges do you face in treating and reporting these cases?
Challenges we always have is that the moment they see the symptoms, they will not come to the hospital directly. So they normally go to the chemist and do their treatment. Except if there's no improvement, that's where they come. And if they come, they'll start complaining of money.
So how do you and your team educate the parents about the importance of vaccination?
Yeah. They receive like measles vaccine for their children. I think they will not be having these challenges. But sometimes some of the parents, they will not come for immunization. So we always ask the CB to go around the community and tell them to bring their children for immunization.
Since the inception of measles surveillance in Nigeria, WHO has contributed and is also contributing immensely to controlling measles in the following areas. The first area is the area of training, capacity building. In the WHO field office in Port Harcourt, we implement annual training for surveillance actors that are directly involved in active case search for vaccine-preventable diseases, including measles and yellow fever. In addition to searching for any cases, other BPDs are looked into. Other area where we support is in our surveillance improvement plan, which are routinely funded on quarterly basis, so that as we try to intensify active case search for AFP, we do integrated disease surveillance as well.
I'm Dr. Kathleen Subramani. I work at the National Institute for Communicable Diseases at the Center of Vaccines and Immunology, and I manage the Measles Molecular and Serology Laboratory. So in the lab, we focus on detection of measles, the measles virus through serology, and that's looking at the immunoglobulin antibodies, just to determine if the individuals that we test do have measles or not. And from there, we take it through to the molecular section where we determine the presence as well of measles in terms of viral detection. And from there, if there is virus present in the samples, then we move on to sequencing and genotyping to determine the distribution of the genotypes of measles within the province. Measles is a disease that's caused by the measles virus. It is transmitted through the respiratory tract, and this is similar to other respiratory viruses through droplets or aerosols, so through sneezing, coughing, etc. So it does require for prevention, for washing of hands, and vaccination is also very important for prevention. And it is highly recommended that all children do get vaccinated to prevent the spread of measles.
There are a lot of reactive vaccination in all the communities affected. We've also intensified routine immunization activities. We've done sensitization in those communities for people to actually carry their children to facility for routine immunization. Also, we have moved those that are affected to the facilities for management. So reactive vaccination has been going on in all the affected communities, and we hope to intensify this as the cases increase.
Okay, so types of challenges as regards to vaccine hesitancy, logistics, and hard to reach populations. How are you able to overcome this?
Vaccine availability is still a challenge. Looking at the number of cases we had at the moment, we're supposed to have carried out mass campaign in all the states, in all the LGs. But again, because vaccines are not readily available, we have to limit ourselves to those communities affected. Again, we're using routine immunization, so vaccine availability and also non-compliance in some cases. And of course, looking at Canada, some hard to reach areas where it's difficult for the team to reach. So that's still been a challenge to us.
What we do is we support the surveillance by doing it. And as part of doing surveillance for the national and of the country, we get samples from the suspected measles cases, which are seen by the doctors and nurses, which are sent to NICD for confirmation. It's because the measles case definition that they are using is fever and rash, and any three of these C's, which is cough, coryza, which is runny nose, and conjunctivitis, which is red eyes that is caused by the infection. So it is important because the measles surveillance also works as an early warning detection. When we get increase in suspected number of cases, we start alerting the province and national that we might be having suspected outbreak while the laboratory is still testing. And by doing that, we also make them to prepare in case we have an outbreak. And once we detect a single case of measles outbreak, they start implementing the interventions such as tracing the contacts of that laboratory confirmed and also vaccinating those contacts. The reason why they do that is to prevent the spread of the disease and also to protect other people in the surroundings that are not immune to the measles virus.
This is a public health message. Vaccination remains one of the most effective ways to prevent infectious diseases. All vaccines provided by the government are safe, tested, and free of charge. Protect yourself today, your family, and your community. Visit the nearest government health center or hospital in your country closest to you. Receive your vaccines. Remember, a healthy nation begins with you. Get vaccinated today.